Hi, social work colleagues and friends. It's an honor to be part of such a valuable webinar organized by the Russian Union of Social Workers. Through this webinar, I hope that Russian social workers and Korean social workers will learn and help each other. We've been very close friendship for a long time. I hope our friendship will develop further despite the corona pandemic situation. Today's topic I'm going to share with you is the response to COVID-19 of Korean social workers as shown in the title. This presentation will focus on specifically what the nursing home workers experienced in the COVID-19 situation. This slide shows overall topics of what I'm going to give a lecture today: the fear of the Korean social work in COVID-19 situation, facility response in massive infection, protecting employees from infection routes, public and private partnership, innovative social work practices, and challenges of the International Federation of Social Workers. Social workers were afraid when the number of new confirmed cases dramatically increased. I live in Daegu. Daegu has seen the most rapid increase in confirmed cases since early March last year after Wuhan, China. The infection, which started with one religious group, quickly paralyzed the community and reached 5,000 confirmed cases. This reality gave fear to social workers working in nursing homes. There are 150 elderly people living in my nursing home. Most of the elderly in nursing homes are people with a severe disease and pre-existing conditions. About 40 elderly people in my nursing home pass away per year. Most of them start with a simple cold and then die of pneumonia. COVID-19, a respiratory infectious disease, was type of pneumonia. So many elderly people were expected to die if they were infected. There are 93 employees in my nursing home. If they are infected somewhere in their community, nursing homes will become a tsunami of infection. Caring is work of helping people in their daily lives at close. Due to the nature of the work, caregivers are likely to have close contact with the elderly, which indicates that they are in a good environment of infectious transmission. Especially, this COVID-19 has a characteristic that it has a lot of asymptomatic infection. Moreover, the elderly does not wear masks. Even though we tell them to use mask, they take it off because it's uncomfortable. When looking at these aspects, the probability of infection in nursing homes was higher than in any other group. It's hard for managers to imagine the consequence of mass infection in nursing home. If such an infection occurs, the facility must be shut down immediately. Nursing homes are operated by the finance of long-term care insurance for the elderly. In exchange for monthly care for the elderly, the facility is paid by the insurer. If the facility for senior citizens are shut down due to infection, the financial burden is indescribably high for managers. In other way, the fears of frontline social workers are little different from the fear of managers. It's a mental stress from the stigmatization. The main stress of social workers was that they should not be a victim of stigmatization from society. The gossips from other social workers tend to be more stressful. And next slide shows facility response in massive infection. First, initial response of nursing home. Upon hearing of the outbreak of COVID-19 in China in February, my nursing home conducted an initial response to prevent it. We first purchased tablet PCs in each living room. Video calls were recommended to listen to the family's concern. In addition, we unified access in and out of nursing home and created additional self-checking quarantine booths at the entrance of nursing home where visitors can personally quarantine for themselves. What should be done inside the quarantine booth was to check the body temperature, wash their hands at a sink, and spray alcohol cleansers all over the body to prevent the virus from infection chains. At a time of rapid spread of COVID-19, some facilities implemented a preventive cold isolation voluntarily. Voluntary cold isolation was implemented in which both the elderly and the staff lived 24 hours a day in a nursing home. It was a formidable task for all 93 workers and 145 older people to live in one building. There was a lot of stress among employees while living 24 hours a day. More serious than anything else is that there was no private space for 93 employees to live in. Nursing homes mobilized all available resources to set up private tents so that caregivers would have no inconvenience in spending their private time. Sleeping at night was important, so we prepared and provided thick mats to avoid inconvenience in personal tents. The period during which we implemented cold isolation was a period of explosive increase in new confirmed cases in Daegu. It is believed that all nursing homes were able to keep the infection rate and mortality rate of the elderly at a low level because of the preventive cold isolation in a peak time. This decision was quickly made with close consultation between the government and nursing homes, and it had a surprising effect. To explain how much it was effective, let me show you a simple comparison between hospitals and nursing homes for the elderly. There is a total of 258 nursing homes and 67 hospitals for the older people. The number of beds of each type is almost the same as 15,000 beds. However, the number of confirmed cases in these two groups was quite different. There were 299 confirmed cases in a hospital, while only 14 were confirmed in nursing homes. That's how much awareness, effort, and dedication have protected the elderly in the nursing homes, where social workers are responsible for. There was no massive infection of nursing home residents in Daegu, which is a high-risk facility, and the level of collective infection in social work facilities nationwide is minimal. It seems that social workers are protecting well the clients. It contrasts sharply when compared the statistics of death toll in nursing homes of United States of America. In some states of America, the average death rate of nursing home was up to 81%. After 2 weeks of cold isolation period, I made a temporary change to the nursing home commuting system. I had subdivided my nursing home into 4 units. No contact was allowed. It was a way to break the infection chain. Visitation to nursing homes have been completely banned since March. On-contact visits have been available since July. On-contact visits were made by meeting family members with windows between them. Due to the nature of nursing homes, employees inevitably meet outside people. The management of workers was the most important prevention because the safety of the elderly would be at risk if one of the workers is infected. We sported enough masks for the workers, and employees were also asked to record their activities after work. With the belief that immunity is restored through sufficient rest, we encouraged workers to use more vacations. And I provided vitamins to all my employees of my nursing home. In the early stage of infection, a public-private partnership organization was quickly launched. The council meeting was active when the number of confirmed cases of COVID-19 increased. The council meetings were always held online. There was also a committee only for social workers who mainly work in the care field. The committee included disabled care, elderly care, child care, and vulnerable care managers. The decisions made at the meeting were implemented immediately. I have reached a conclusion through this process, which means there is an answer at the field of aspiration. It could be introduced 3 innovative social work practices that led to innovative changes in the field of future social work. As the lockdown has been sustained for a long time due to COVID-19, social workers have developed the practice of social service in various ways. For children who have not been able to meet their parents who live in nursing home for a long time due to lockdown, we try to increase their intimacy with their families by supporting tablet PCs to be able to make video calls once a day. Social workers have been fighting the virus for months in the COVID-19 situation. As a result, social workers working in the field experience exhaustion, and the need for method of crisis response emerged. Psychological quarantine is now the most needed service for clients and social workers in the Corona era. In the wave of COVID-19 situation, there is a growing awareness in Korean society that social workers are essential workers, along with medical staffs. Not only in Korea, but also all over the world recognize that we are essential workers. There is no doubt that the International Federation of Social Workers has done a great job during the COVID-19. The International Federation of Social Workers shared the ever-changing environment between countries on Facebook and its website in the form of a statement. Through webinars, they shared information about each country and provided opportunities for each other to be challenged. Not only the world-class webinars, also the regional webinars were held. Various topics were held in Europe as well as Russia. I remember that Russia also put a lot of effort into hosting the webinars. I was also honored to have a chance to participate in your webinar last year. I was grateful that there was a time to listen to each other and share the situation through various webinars hosted by the President Antonina Daskina. However, the need for networks by similar affiliation was more required. There is also regret over the COVID-19 response from the nursing home. It is challenging to the human rights of the elderly. The human rights of the elderly were restricted in the situation of COVID-19. The human rights of the elderly and caregivers were easy to be ignored. I think the issue of the senior citizens' human rights should be dealt with in greater depth in the future. In my conclusion, I would like to propose 2 things to prepare for the future. First, the need for awareness of with Corona. We may really have to live with Corona for a long time. I'm not sure how to learn a nursing home in the era of with Corona, but it's time for us to think about what to prepare for with Corona situation at a nursing home where face-to-face contact is essential. Second, the need for preventive equipment and structural preparation. It seems necessary to develop and support essential equipment to live with corona. It means that the facility structure of nursing homes should be changed gradually, and more effort should be made to develop service using high-tech rather than face-to-face labor. I would like to wrap up my presentation by saying, may peace and safety be with you. Thank you very much. God bless Russia.